I'm Dr. Seide. I'm an internal medicine and integrative medicine physician in Southern California. Welcome to today's chat. I've invited Shelley Cerny, who is a licensed acupuncturist, to come chat with me about different health conditions that both of us see on a regular basis. The topic that we've chosen for today is migraine headaches.
But I look at migraines as being an electrical phenomenon and very similar to seizures in the way they progress across the brain and the way they have an aura before it happens, as well as a lingering kind of dip that in somebody with seizures we'd call a post-ictal period. So as I'm seeing somebody who presents with migraine headaches, I'm thinking about their brain, I'm thinking about its electrical milieu, I'm thinking about things in their diet that affect their brain, that affect levels of electrolytes that have an impact on nerve contractility. Yeah. Hormones comes up, especially if it's a woman who's still in years where she's cycling. I think about the impact of hormones on headache frequency.
Well, for me, I'm always asking first, where are the migraines? And most people have temporal migraines, or it's like this whole neck system tightens down and then pulls everything tight, and there's not the right circulation to the head. So mostly what I see are either hormonal issues, or which are also sort of the same as stress migraines. So that whole system is affecting the liver and gallbladder, and that's usually what we work on. Sometimes the heart can be involved, like those will be more in the eyes. Like in particular, like a stabbing eye migraine, like that one is heart-based. So.
You know, my understanding of meridians is rudimentary, but I seem to remember that one courses through. Not that you'd put needles in somebody's eye, but that the meridian itself passes through.
Yeah, people do, but.
Really?
Yeah, wow. They'll go into the campus thing.
Like where the duct is? Wow. That would be hard to tolerate, I think.
I think I would never try that. I don't want to injure someone.
So any other organ systems, or maybe a little bit more about how liver, gallbladder?
Yeah, the liver, gallbladder, it's such a complex one. So hormonally, the liver's job is it regulates hormones in many ways in Chinese medicine. Like if we have a woman who's coming in for monthly migraines, then we'll work on sorting out that whole hormone system, especially using the gallbladder and liver points. Like the tension headaches that happen, I have these sometimes where I can feel like the gallbladder channel runs through the neck here and along the trap.
Say in Western medicine, someone having a gallbladder attack, it will hurt in the shoulder. Exactly. We call it referred pain, and like heart attacks, they'll feel in their arm or their jaw, and sometimes it goes undiagnosed because the person just says, I just have an ache in my shoulder every time I eat fatty foods.
Right, the heart attack in the arm, like the heart channel is all through the arm. Sometimes if there's too much tension, or like we're very triggered by a stressful situation, this stuff can start locking down. And then you're chopping off the circulation through the neck that's supposed to be running to the head and the rest of the body. So like this all has to be reopened, and we have to get it circulating again. There's a Qigong move in the form that I know that actually works to keep all of this open. And then we have herbs too that actually go right here, and they open the channels back up, so they can work very quickly sometimes.
I'm sorry, what things that go?
Herbs that open.
Herbs. Okay. And do you do moxibustion?
Rarely.
Can you say a little bit more about that? Because I guess some people watching might not know what that is.
Well, moxa is it's mugwort, which is a plant, an herb that it burns very hot. And so mostly in cases of cold, we can use it, we can burn it at points, and it'll really help open and supercharge that point. We don't use it in LA a whole lot because this is a very hot climate. And so most of our problems are too much heat.
Uh-huh.
So adding more heat can cause more trouble. People who are very well versed in it, they know how to use it even in heat conditions to get it to work.
Yeah, I notice, having grown up in a very cold environment half the year in the Midwest, there is definitely a difference in headache patterns even.
Yeah.
When I lived in the Southeast, which was hot and humid, versus the Pacific Northwest, which was dry and cool, and now LA, which is dry and hot, and we don't know that we'll ever see rain again.
I know.
So Western treatment of migraines, I think so much of our knee-jerk reflex with pain is to try to give pain relievers. And unfortunately, a lot of people end up with high doses of nonsteroidals like Motrin or narcotics. And they may be a temporary fix, but they aren't really addressing the underlying issues. I love the integrative approaches to getting somebody to develop a meditation practice, alter their diet, look at their activity as a holistic way of treating them, instead of just giving them triptans, which maybe address the neurologic part of the headache, but then give them chest pain.
Right.
How do you see what you do with the needles or herbs as functioning alongside? Because it's very difficult to get somebody off of medications that they have relied on for years.
Yeah. I'd say most of the people who come in are like, they don't want the medication, right? So they're looking for another way around it. But I see, like, acupuncture is another commitment for migraines. Usually I'd say 2 to 3 months, once a week. And pretty immediately, the frequency of the headaches will go down and the severity. And then hopefully by 3 months, we've got people with maybe one a month, if that.
When we talked about high blood pressure, that the person who seeks you out is someone already willing to make some changes, I think is really key. Yeah. One thing, as I became more interested in Eastern medicine, I realized there was so much to learn. And with the number of years I have left in my life, I'm not going to learn everything. And so I don't understand it completely. And at first I started to think, well, I don't know that anything will benefit me that I can't understand. And then I had to realize how many patients come to me in Western medicine having no idea how a triptan works, how a beta blocker works, and yet they trust that it will.
Yeah.
And so I guess I've had to let go of some of my need of understanding it. And do you see that with patients, that there's effects that happen regardless of whether they know exactly what those needles are doing?
Totally. I mean, almost no one knows what they're doing, right? It's funny too, like, you can search the internet and people will still be trying to say that acupuncture is placebo, which is ridiculous. Like, I mean, we have like 3,000 years of medical history.
Placebo's gotten such a bad rap. I think of two things as you're saying that yes, there are studies that show it's effective against standard therapy, not just against placebo. So I think that's true. But I also think that we have totally underutilized the placebo effect. And I think we've named it that in a disparaging way, rather than really looking at what is it that's happening, what's in that provider-patient relationship that is so valuable that there's a 30 to 40% response rate. Anything else we want to say about headaches?
I mean, probably you see this too. Like, occasionally people really desperately need to make a scary lifestyle change. Maybe they're in the wrong relationship, or they're living in a toxic household that's full of mold, or who knows what.
And what happens when they can't make that change?
Yeah.
Economically, they cannot move from that place, or the relationship is one of instead of a person you choose to be with, a person that you can't not be with, an aging parent that you're taking care of, or yeah. How do we support and help people through life situations that we think should change, but realistically can't?
I mean, personally, I hold for more ease for them and just talk to them about what they could do to institute self-care.
Yeah, and maybe a little bit more about self-care, because I think that's gotten a bad rap. It's just getting pedicures and
Okay.
what does it mean to truly care for yourself?
Yeah.
To take the responsibility for your life and care for it.
Yeah, I mean, it can be an extremely deep question, right?
Right.
Much deeper
Right.
pedicure.
Sometimes it's not taking a break from what stresses you. Sometimes it's really having to go into what stresses you.
Yeah, and examining beliefs around it. And
As always, Shelley, it was great talking with you. I'm always intrigued to hear how you view things from a traditional Chinese perspective. Also, I really just look forward to continued conversations as we share patients together. And for those of you watching, if there's any topic that you would like us to delve into, please put it in the comments, and perhaps you'll see it on a future East Meets West conversation.